Aloha and welcome. My name is Erica Warner, and I'm one of the clinical specialists here at the Association for Infant Mental Health in Hawaii, or AIMHI. Thanks for joining us again. This is the second part of a two-part series on trauma-informed care after a natural disaster. You joined my colleague Anne-Marie in part one, and today we'll dive deeper into the stress responses of children ages 0 to 5 following a trauma. First, a trigger warning. We will be talking about stress and trauma responses in young children today, and this often brings up feelings for folks. We're also going to reference the Maui wildfires, and we know that some of you may still be recovering from the impact of this exact disaster or be recovering from an array of other traumas or stressors. So we highly encourage you to take care of yourselves today. If at any point you need to pause the video, take a break, move your body around, or seek support from somebody, please do so. This training module has been made possible by the Preschool Development Birth Through 5 Renewal Grant from the Administration for Children and Families at the U.S. Department of Health and Human Services. The contents do not necessarily represent the policy of the funding agency, nor does the publication in any way constitute an endorsement by the federal government, the Executive Office of Early Learning, or the Hawaii's P through 20 Partnerships for Education. So before we jump into the material, let's take a minute or so to get grounded. This is something we often do at AIMHI. Grounding activities don't have to be big or long, and they can be done in large groups, small groups, or by yourself throughout the day. They're a great way to begin any meeting you're leading or to help you when you're at your desk or in your classroom becoming overwhelmed or distracted. Remember, part of being trauma-informed is doing the preventative and promotion work for yourself, your teams, and the families you work with. Incorporating small mindfulness moments is a great way of doing this. I'm going to lead you through 3 deep breaths. If it feels good for you, you can also add some muscle tension and relaxation by squeezing all your muscles tight when we inhale and then relaxing those same muscles when we exhale. Again, this is optional. So go ahead and close your eyes if that feels okay, or gaze away from the screen. Exhale all your stale air out. And just notice the weight of your body on whatever surface you're sitting on. Now take a deep breath in through your nose and squeezing those muscles if you choose, with a tiny hold at the top. And now exhale, let all that air out and feel your belly decompress. Again, taking a deep breath in through your nose, tiny hold at the top. And now a deep exhale. Last one. Deeply inhale through your nose, fill your body up with air, and exhale it all out. And before opening your eyes, bring some small wiggles to your body or stretches that feel nice. And we'll go ahead and get started. All of the trainings we do here at AIMHI are developed around the infant and early childhood mental health competencies that AIMHI and all other AIMs across the globe use to support learning and professional development for those who work with Keiki and their families. Today, our competencies that we're covering will be around theoretical foundations and infant and young children development and behaviors. And we'll touch on each of the skill areas listed here as well: relationship-focused practice, attachment separation, trauma, grief, and loss, observation and listening, and curiosity. In this training, we'll hope that you'll be able to explore some different responses to stress and trauma that are often experienced by children. We're going to ask you to identify one child in your life that might be experiencing a reaction to stress or trauma. And also, we're going to go over some different strategies to reestablish the protective shield in the classroom. More on that later. Let's get started by doing a quick review of what you saw in part one with my colleague Anne-Marie. First, stress and trauma are common for kiddos. We wish they weren't, but they are. And we need to acknowledge that big and scary things happen to Keiki, and it does have an impact on them. Secondly, we looked at the concept of big T and little t. In a natural disaster situation, the natural disaster is a big T, a big trauma. And following that event, there are likely lots of little t's that might show up for folks. Moving several times, sudden food insecurity, new neighborhoods, new schools for Keiki, loss of routine, loss of structure, and so much more. Both little t and big T's can result in trauma responses that are categorized into the F's: fight, flight, freeze, or fawn. And furthermore, that Keiki's responses to trauma don't always look the same. Some we consider to be more of internalized responses, going inward, and some we see as more externalized, changes in behavior that are outward. Since we're talking about trauma in very young children, I thought I'd use a children's book to look even deeper at how trauma responses show up in Keiki. This book is written by Aim High's friend and child-parent psychotherapy trainer, Chandra Ghosh-Ipin. You can find more of her amazing books at piploproductions.com. And while we won't be reading the book today, we will be using one of the resources that's available on their website. It's called the Symptom Screener. The Symptom Screener is not meant to be a diagnosing or treatment tool, but it can be a great starting off point to think about a child in your life that may have experienced a big trauma. I won't share it directly with you today, but you can request the Symptom Screener for yourself on the publisher's website. A little about the book. In this book, we meet a group of different animals in the forest, and they've all experienced something scary, but they all react a little differently, which can help us and children understand different reactions to stress and fear. So before we go through each animal and their different reactions to stress and trauma, we're going to start our first activity. So take a moment and think of a Keiki in your life. Maybe this Keiki's in your classroom or in your personal life, and maybe they were impacted by the Maui wildfires or some other big trauma. Do you have your Keiki in mind? Okay, great. So on the handout provided or a blank piece of paper, I'm going to ask you to kind of write down what symptoms you see in the animals that I share. Maybe these are behaviors or reactions that you've observed in the Keiki you have in mind. And as we go through, I'll give you some examples of what the listed behaviors may look like in real time or in the classroom environment. So get your child in mind and let's get started. One common symptom after a scary event is what we refer to as re-experiencing. When we re-experience something scary, it often shows up in our bodies through sleep disturbances or changes in appetite. For kiddos, it's really common to have a lot of questions and try and make sense of what happened, maybe even through their play. The language of children is play, and so they will often use play to try and figure things out about what's been going on around them. Notice that some of these behaviors are externalizing and some more internalizing, but the symptom is the same, a re-experiencing of what has happened. Some children might show none of these behaviors, and some might show one or two, while others have all of these. Every child and adult has a unique presentation after trauma or something scary. And with children, we always have to be thinking about their development. If a child was a few months old when the fires happened, sleep problems might not be a reliable symptom to say the child is re-experiencing an event, because they're still learning how to sleep, and we would accept some sleep issues. But if a 4-year-old that was sleeping on a regular schedule and having no sleep disturbances, after the fire, all of a sudden is waking up every hour, then we would be able to endorse that sleep problems is a symptom this child is experiencing as a direct effect of what they went through. But how do these behaviors show up in group care, right? Maybe changes in eating at lunch or breakfast. Maybe this child was sleeping well during nap and now is highly agitated at that time. Or maybe the child is playing out events around the fire or the other traumas that occurred, or just general themes of death and dying. Remember, children ages 0 to 5 will interweave fantasy and reality. So if they're playing out an event and the sequence or the details aren't correct, that's okay. It's not the time to interject. Actually, following their lead and staying curious is our best course of action, as long as they're safe, not hurting themselves or anyone else. Let's take a look at the next symptom. Another common symptom is hypervigilance. You ever almost been in a car accident? Or almost in any kind of accident? And then you felt on edge afterwards maybe felt nervous to drive, or your body got tense when you passed the area that accident happened, you're always on the look for the next accident. That's hypervigilance. And kids experience the same feeling, but it might show up a little differently. These are our Keiki with lots of energy, right? Think about the current of energy in their bodies being higher than those of other kids. At all times, they're ready to run, hide, fight, react. When we're highly focused on looking for the next threat, or always thinking about the threat, it's hard for us to focus on other things, and our bodies want to stay in motion. Think about the Keiki you selected at the beginning. How do these behaviors show up in group care? Maybe this is the kiddo that climbs everything, can't sit in circle, can be very protective over items, toys, other children in the room, has big reactions to noise or changes in environment. Now, some of this, of course, could also be related to sensory processing challenges or other things. But if we know a kiddo has had some chronic stress or trauma in their life, we may want to look at these experiences as the reason for his behavior, for this challenging behavior, as it's often referred to. Let's keep moving. Remember that car accident example? Well, maybe you just stop driving altogether, or maybe you don't go that direction anymore. This would be called avoidance. This stress and trauma response often gets kids in trouble at home and school. We often refer to these kids as they no listen or they zoned out, but maybe they're just sensitive to their environment. This Keiki may not want to talk about the event or may strongly protest when or around reminders of the event. They might have long and sustained tantrums if reminded. They almost might deny it happened altogether. This can sometimes look like what we call lying, right? Anything that seems like a threat, like admitting I took a block from my friend during center time. That's scary. I might get in trouble. So they don't just avoid the scary thing or reminders about it, but could avoid any feelings that feel too big or unmanageable. Oftentimes, children may have mood changes after a natural disaster or any other big trauma. They can be for an array of different reasons, and there's hardly just one. Remember what Anne-Marie talked about in part 1 about the internalizers and externalizers? Notice that the mood change is internal, but there are symptoms like increased crying or what is often referred to as flat affect, when a child has a limited emotional range. They aren't as happy or excited at new things or loved items and people. And likewise, they might show a little resistance or protest to unwanted items. This can also be our preschooler whose belly hurts or head hurts often, or just not feeling well in general, but we can't find any physical causes. Think about the Keiki you had in mind. Are they internalizing or externalizing? How's their mood change showing up? Another common mood change in children after trauma is anxiety. Keiki may have anxiety following a big T or little T's. And depending on what happened, we'll see anxiety look different in each child. Oftentimes, the child with anxiety can be referred to as clingy or baby, always like to be carried or cry for carry, or even spoiled. And remember, we also want to think about development when talking about the 0 to 5 age group, right? So an infant should be experiencing some problems separating from their caregiver. We don't expect them to explore new things alone. It's developmentally on track, right? But a 3-year-old who was easily doing drop off and pickup might be having a harder time after the fire, or after their third move, or after another family member moves away. These can be those little T's after the big T, right? That create ongoing uncertainty for kiddos. Anxiety in children can look like, I have no fear and will do anything with anyone, or like all the fears, won't explore even with trusted caregivers, and has strong reactions to separations and changes in routine or structure. Because of this, children with anxiety can often be seen as acting younger than their age, which can be really difficult in a classroom environment. Another hard behavior for us to deal with as caregivers is anger. Anger is a common emotion following a big trauma like wildfire or other things that create a sense of loss, right? So anger can be looked at as like an iceberg, right? We see what's on top, but there's often something much bigger happening underneath. Anger is a really efficient way at keeping people away from you and often getting what you want. Anger is efficient at protecting self and controlling the environment. But underneath is often a lot of fear and hurt, right? And so when kiddos are experiencing arousal, it's similar to hypervigilance we looked at earlier, but a lot of the energy in the body, right? But it comes out with long and strong tantrums, difficulty calming down. They may use their little bodies to communicate through hitting, biting, or kicking. In group care, this can also look like really small frustration tolerance for new things or emerging skills, getting frustrated with self or others really easily. The symptom of dissociation is often overlooked or goes unnoticed because people prefer quiet children. When a Keiki's experience disassociation, they may look zoned out or stare into space, not play with items right in front of them, and maybe even avert eye contact. They may be re-experiencing the scary event or trying to avoid thinking about it, which creates the dissociation, a safer place in the mind. I've heard caregivers say things about Keiki like, they don't even care when, or they don't even flinch when, or they're such a good girl or boy, they don't ask for anything. But remember, kiddos age 0 to 5 are supposed to need things from their caregivers. It's a positive mental health sign to want and need their caregivers in almost everything they do. So if there's a sudden change and they're not needing help and they're looking zoned out often after something big and scary happened to them, they might be experiencing this symptom. A very common response will be changes in cognition or sudden changes. After a trauma, big or small, you might notice significant changes in the children's behavior. Have you noticed any of these with the keiki you chose for this activity? Sudden shifts in relationship or view of self or their environment. Maybe they always wanted to go to grandma's house and now they suddenly don't, or they were fine being at the park with their auntie and now they don't want to go by themselves, right? They could have changes in the way that they respond to other people and also the way that their bodies respond to any reminders of the trauma or the experience that they had. This can be really difficult in group care, as if a child is having a reminder and we're in a group activity and not every child is impacted, they might need some individual care at that time. Another really common stress response will be completely physical in its manifestation. We may see a total regression in skills or abilities. This one is usually the most noticed and worried about. Parents and caregivers tend to notice a total regression because all of a sudden their children require more support in something they had mastered before. And if it's toileting, that can be really frustrating. But the delay or regression can also be social. Maybe they stop entering into associative play or parallel play when they were prior to the event. Or maybe they were putting together 3-word phrases and now back in one-syllable words. Like any of the symptoms discussed today, there could be a multitude of factors. With delays or regressions, we want to encourage families to speak with their pediatrician and other infant and early childhood mental health support providers. Okay, let's take a moment and look at what symptoms and behaviors you wrote down. You can flip over your handout or use a blank piece of paper, but take some time to reflect on what you wrote. Did you know these were trauma symptoms before? And if not, are you looking at them differently now? And furthermore, what do you know about this child's family story and history that may have resulted in some of what we're seeing today? If you're doing this training or watching this video with a colleague, please share with each other. I hope you were able to have some reflection time, and welcome back. We're all in this field because we want to help, right? And knowing what to look for is really helpful, but we also want to know what we can do. So let's take some time to look at what we can do as early educators to help kiddos with their reactions that take place in your classroom. When bad things happen, we don't trust our safety. Maybe the safety of the environment, certain places, or even people. And this is true for children too. When we are small, we are 100% dependent on our caregivers to keep us safe. Now, as grown-ups, we know that that's not 100% possible all the time. We aren't in total control, but kids think we are. So when things are unsafe, whether in our control or not, the protective shield the child imagines the parent holds is broken. Imagine a dad walking down the street as he does every day with his 8-month-old child in a stroller. But today, a dog comes running around the corner with no leash in sight. Dad instantly swings the stroller around, sensing the danger, and thank God the kiddo is strapped in, but he's suddenly whipped in the other direction and beginning to scream, and he's scared. The dog comes chasing. The dad starts running. The dog bites the dad's leg, and he falls to the ground and begins to scream. The baby is watching the dad fight off the dog, and the dog swings around and nips the baby's foot. While the dad finally gets a good whack in and sends this dog running away, the baby's now screaming in terror and pain. Dad's bleeding. Neighbors are coming out. The police and ambulance are coming by. Dad had called mom, and mom's now running down the street screaming and scooping up her baby in fear. And the parents stay up all night and talk about it. A lot just happened. And nothing here was the dad's fault. But yet, the baby still might feel like that shield was broken. He may feel now less comfortable with dad, or refuse his stroller, want his mom to be closer, or not want to go on walks at all. This child may be fearful when they see dogs on leashes in the community, even ones that they're familiar with. This kiddo might have difficulty sleeping or even eating after the event. They suddenly feel exposed to danger and might question the safety of their caregiver. This can be true for any big or little tease. In a natural disaster, a lot of things were out of control of the adults, which is really scary for Keiki. They may think or believe any of the bullets here on the screen, which we could see would greatly impact the way you would move forward in life. They need adults around them to re-establish the protective shield. And we'll go in on how to do that in the next slide. Luckily, there are 3 avenues where we can reestablish the protective shield in our classroom. I'll use the dog bite example as we go through some of these to give you a little more context. But we'll start on the left with play. Play is the language of children, and we want to let them lead. They use play to figure out what they experienced and what could have gone differently. So let them tell their story. Watch them play. Watch them reenact the story. And remember, Keiki will often interweave fantasy and reality. So if this child that experienced the dog bite has a dragon swoop in and take the dog away to doggy heaven, this isn't the time to correct them and say, dragons aren't real, or that's not what your daddy told me happened. The child might be trying to re-experience the situation in a different way where they feel safer. And that's what we want them to do. We want them to explore the different perspectives and different realities. So this is not the time to correct. We just watch, wait, and wonder. And we witness their story. We only engage when they ask us to and they prompt us to be there. Another great activity and language of play to use with children after a big or little T are books. As you saw today, there's a book for almost every situation and event. And so we can use books to help children understand and give them a language to what they experienced. Now, we want to be intentional about this. If a child is experiencing hypervigilance or having other re-experiencing symptoms, we might not want to use the book. So we want to be intentional and use your best judgment as the caregiver. And this might change as they get distance or more time from the event. So immediately after might not be a great idea. 2 or 3 months after could be, right? You'll have to decide this as the caregiver. Art is another great way. So we can have children draw what they were feeling like, or have them draw the event that happened or what they hoped had happened, right? And again, we want to use this intentionally for each child. Also, activities. I noticed after the Maui wildfires, spending time in preschools, children wanted to play firefighters. People wanted to play ice team and fire team. This was actually a really great creative idea by these children to understand each other and to understand each other's experiences. So again, as long as they're not hurting themselves or hurting someone else, we can support, scaffold, and even encourage play about some of the things that these children have experienced. One thing you're doing already in your classroom is routine. You have a welcome period, you have places that things go, the children know what to expect. In and after a natural disaster or any other scary event, school might be the most predictable place and the most consistent. They know where their backpack goes, they know what time lunch is, they know what friends are going to be there, they know what to expect. And when they know what to expect, they can feel confident. School might be the calm in a child's life, right? And what we know about trauma in children is that sometimes our normal verbal cues and instructions no longer work, especially if they're in the midst of experiencing a trauma symptom. So this is when we would use visuals or little cue cards or other visuals that you use in your classroom, and also hand motions or using our bodies to help guide and give the next instruction. And with our schedules and our rules and our program expectations, we want to refer to them often, and we want to make sure that children understand that we use these universally and that these expectations are universal to make things feel safe, predictable, and consistent. We do this all through relationship. When we have a relationship, not just with the Keiki, but with their primary caregivers, we can be a greater impact of change. First and foremost, we always want to have a calm, safe body and voice. This might require that we check in with ourselves before intervening with a child. It might take a moment for us to get regulated before we talk to a kiddo. And that's okay. We're modeling it. And it's not just the relationship with the Keiki, as I said, but with the caregivers. What type of relationship do you have with this child's primary caregivers that could support this child's healing after this scary event? How much do you know about the family story, how much they've been through? Maybe it's not just around this natural disaster, but before, or maybe what they're going through now. We want to really listen, not so that we can solve the problems, but so that we can let the caregiver feel held, supported, and heard. We might be able to link them with resources. And not just link them with resources, but follow up and ask them how that appointment went or how that referral went and what's changed since. We want to keep relationships going with the families that we work with. Another cool relationship tool we can use for kiddos to make them feel safer and more secure in our classrooms is having special rituals for the child. Maybe it's a way you guys greet each other before they come in the classroom. Maybe it's a way you say goodbye. Or maybe it's something special that happens between the two of you when this child is triggered or just having a harder time and needing more support. Most importantly, relationship with yourself. This job is so difficult. And if you're not taking care of yourself, it's going to be really difficult to take care of the children in your classroom. So make sure you're taking care of you. Now we'll put these simple but powerful tools of play, routine, and relationship to think about how you might support a child that has experienced trauma. With your handout, think about the kiddo you identified earlier today. Take some time to reflect on each of these three elements and how you could use them to reestablish the protective shield. When you're done, please find a supervisor or trusted colleague to share your reflections. All of our learning here today has been supported by these publications. We want to thank them for their knowledge and bodies of works, and we want to thank you for being here with us today. Mahalo nui for being here with us. Remember that each time you take time for yourself to grow in your professional knowledge or your personal way of being, you are directly impacting the Keiki that you work with. We hope to see you again in the future.